Welcome back, it's Dr. Somji. We're going to be talking about something that you see trending on TikTok all the time. Is these little things that are commonly mistaken for blackheads. They're called sebaceous filaments. Let's see exactly what I'm talking about. So these pore strips are really popular. Pore strips get a bad name actually, but you can probably use these if you've got quite severe kind of blackheads on the nose as well as sebaceous filaments, and we'll talk about the difference. But that's extremely satisfying, slightly painful. So what are sebaceous filaments? Well, they're a collection of sebum and dead skin cells. In fact, they're absolutely normal in terms of your actual skin function. So they're actually essential really for the control of sebum, helps remove sebum slowly to the skin surface, hydrating the skin and giving a kind of essential oils to the skin. So, and these oils are actually good for the skin. We use things to obviously replace those oils to help with your skin barrier. So things like squalane we use in ingredients, but we produce our own squalene. We produce our own triglycerides, fatty acids, glycerol, wax esters as well. So these are all things that are good for the functioning of the skin. And if you're removing these sebaceous filaments, all that will happen is that they'll collect up again. So you don't necessarily need to remove them, and you definitely don't need to use something so aggressive like a pore strip. You've got those ultrasonic extractors, which are actually a lot more gentle on the skin, and they also reduce the appearance of those sebaceous filaments, because all I see is doctors saying don't remove them. But people want to remove them. They don't look so great on the surface of the skin. So if you can remove them and also treat with the skincare products that I'm going to talk about, you'll also reduce how quickly they come back, so you can stay on top of it. What is the difference between sebaceous filaments and a blackhead? Well, blackhead again is made up of sebum, dead skin cells and bacteria, but they collect around a pore or even within a pore. And that's where you see the difference between a blackhead and essentially a sebaceous filament. You want to be making sure that you don't really kind of squeeze this area, because obviously you risk it spreading bacteria. So even after you use something like a pore strip, if you're going to be doing that, you want to be doing something that reduces the bacteria within that area, so it doesn't result in sensitivity, breakouts, etc. So the goal is to prevent those sebaceous filaments building up. So, I'm fairly comfortable to say to patients, look, if you've got these sebaceous filaments, use an ultrasonic extractor. You can use a mild pore strip like once or twice a month, but you really need to be using proper skincare. So what would you use? So in the AM, one acid that you really want to be using is salicylic acid. As you guys know, it's one of my favorites. You can use the Ice Clinical Cleansing Complex, which is at a little bit more of a higher price point, but it's got a great blend of lactic acid, salicylic acid, glycolic acid. It's gonna really remove that debris from the area, and it's also gonna loosen the area. So if you're really extracting and you wanna just prep the area, you can use a salicylic acid-based cleanser. There's some great salicylic acid-based cleansers from brands such as the CeraVe, and again, in ultra high end, you've got the Zedo Skin Health exfoliating cleanser for normal to oily skin, which you can use as well. You want to be doing that AM and PM if you're prone to getting these sebaceous filaments, particularly around the nose area. Also, the other thing that you want to be using is a serum that helps exfoliate. So you've got things like other AHAs and BHAs that can really help that area. So you can use something like the ordinary AHA BHA mix as well as the Paula's Choice one 2 or 3 times a week, just to help with further exfoliation within the area. You don't want to overdo it because you can increase your chances of sensitivity, but using this 2 or 3 times a week is going to be a really good idea. The other thing is that you want to be using the superstar product within skincare, which is essentially retinoids, and that should be used once every night. Yes, you can use retinol, which is certainly something that's strong enough. Look, you've got this one from the Inky List, which is quite nice. It's a simple one to start with, and it's something you can use on a daily basis and is not too strong. As we all know, the Ordinary do an upward sliding scale of concentration, I would recommend the ones that are mixed with squalane because they also help with the skin barrier and the protection of that skin barrier as well. So you want to be using a retinol in your PM routine after using your salicylic acid based cleanser. The other thing which you might have seen me on social media using for those blackheads, especially if you're a darker skin type, is not use the AHA BHA, because this can increase the amount of pigmentation if you use it too regularly because of the amount of glycolic acid in it. So if you've got my sort of skin type and you've got that sort of oily sebaceous filaments within the area, sorry, the wrong product there. The salicylic acid mask is really cool. And using this 2 or 3 times a week is going to be great. You apply this on freshly cleaned and dried skin. You want to put it on for around 10 minutes over the nasal area and then wash off. Once you've done that, you want to help that skin barrier. And there's nothing better for the skin barrier than niacinamide. And the niacinamide 10% plus zinc 1% from The Ordinary is quite good. I've done a previous review of this product. Look, don't get scared with the 10% because it's almost, I think this is like a sugar coating on a label. They say it's 10%, but really it's not too strong. Most patients don't really irritate from there, but I would still use it sparingly, but definitely to help your skin barrier, to help the way that your skin functions, and to reduce the chances of those sebaceous filaments coming back, then this is a good idea. So in summary, you want to be using a salicylic acid based cleanser. If you've got lighter skin types, AHA, BHA mixes 2 or 3 times a week are great. If you've got darker skin types, a salicylic acid mask from The Ordinary is fantastic, but you want to reduce that oil production further by using things like retinols and niacinamide over the top just to maintain it. These pore strips, I would not recommend because some of them are quite abrasive for the skin. Using an ultrasonic extraction is going to be a lot safer, or even see your local esthetician. Things like the hydrofacial are fantastic for extraction. There's some great close-ups that you can see. It's a lot more gentler on the skin. It just fires little small jets of AHA BHA mix just to help loosen those sebaceous filaments. So the aim is to maintain the sebaceous filaments, not just remove them every week and essentially damage your skin. One bonus tip from me is that I use a couple of different treatments within clinic to help reduce the size, the diameter of those sebaceous filaments when they've been extracted. Because obviously you extract them and then you've got what looks like a hole in that area. You want to improve the collagen within that region. CO2 lasers, fantastic to help build the collagen and just shrink that appearance of the sebaceous filament, as well as the diameter of the area, and also using a TCA cross, so trichloric acetic acid, which is 100% acid, just into those small areas where you've got the sebaceous filaments. I find that just reduces the oil production over time, which is great, and also just closes that area so you've got a better, smoother look. If you've got any more questions about sebaceous filaments or anything about skincare, just let me know in the comments below. Don't forget to click the link to subscribe and also the bell to make sure that you're updated with all the new videos that we're releasing.